Hello, this is Dr. Brian Buccellato. I'd like to illustrate to you the true necessity of a 3D X-ray and the advantage we have at Alpine Dentistry with a computer-guided implant treatment. And this patient here needs an implant on the upper right. The image I'm looking at here shows a typical 2D panoramic image. It looks like this is a lot of space to place an implant, a lot of area up here for an implant to go. That's not quite true. If we take a 3D look at this, these images will show us the width of that bone. This is the outer cheek and face. This area here is the roof of the mouth. And this is where the tooth came out of when it was removed and what we have to work with to place an implant into. An implant needs to go exactly in this area. That's actually a pretty skinny area. We can measure it here with this tool. We have about 5.5, maybe 6 millimeters of bone there. And that's a pretty skinny area. We need to guide this implant into placement. What we can do in this software is place that implant digitally. That's what I've done. So we place that implant right where it needs to go. We can see how it's going to emerge out of the tissue and be able to put a tooth onto that. And what we did next is make a guide. The guide will fit over the teeth. This yellow thing here can be 3D printed in the office. That will fit over the teeth at time of placement, and the implant's going to go right through that hole, and that's going to make this a quick and easy treatment at the time of placement. I've already done the hard work at home on this software and making a guide. When you come in the office, we simply put this over the teeth, numb the area, place this through that guide, and it will land exactly where I planned it to go. Let's find out what that looked like in the true result. This is the X-ray we took after placement. You can see that is perfect. That is exactly in the bone, all the way on the outside, all the way on the inside, and as long as the implant is available for purchase. And that's going to be a successful implant. So this would have been very difficult to do without a guide and just looking at that area and kind of guesstimating what angle to place that implant. That would have been very hard to do. With a guide that makes it simple, easy, predictable, and what matters for you is that it's going to work and it's accurate. So thank you very much. Hope to see you soon.